migraine is a disease. It's a neurological disease. It's actually a leading cause of disability in the world. People with migraine want to work, and there are cost-effective ways to help support people with migraine in the workplace that benefit everyone and increase productivity.
What would you like to see all employers do for their workers with migraine?
Create migraine-friendly work environment, and not just the physical adaptation, but also in terms of workplace relationship, help support people getting the reasonable work accommodation that they need and they have the right to, establish workplace health education and management programs.
Okay, excellent. So to work or not, do you have a recommendation that people that suffer with migraine, should they work if they want to, if you live with migraine?
But there is work and work, right? There is work and can you work? Probably actually a good number of people with migraine could work. It's what type of work and does that match with the professional dreams, professional goals? So I think it's more even than to work or not to work. It's like a problem oftentimes is that people with migraine can work, but sometimes in my office there's such a mismatch between what people are actually doing and what people did for the studies, and then when you ask more questions, what they intended to do is very different. So people oftentimes can set up for jobs because they have to work, they need to work to support themselves, support their family, if they have a family, to actually keep access to care and medication. But I think this is more complicated than that. And then work, but work at what cost? Because people with migraine, once they work and when they work, they're very dedicated to the work, they push through, they put work on top of everything else in their life. So sometimes they push through at the detriment of their well-being, of their health, of their access to care. So what is the cost of working? So I think it's not so much to work or not to work. If you want to work, is how can we make it so people can work in conditions that help people manage the disease and also do something that they want to do.
Thank you so much. Are there any final thoughts you'd like to leave with our audience?
I think it was pretty in one of your questions, but I think about the isolation of migraine. Migraine is terribly isolating. And I think it's important to always remind ourselves and everyone that people with migraine are not alone. There's more than 1 billion people in the world. Sometimes when I see people in the clinic, I just want to break down the walls or make group visits, because the people from different stages of life, but sometimes such similar presentation of the disease and symptoms and obstacles they are facing. And I think that's why it's important to have education like what you are doing with the Migraine World Summit, but also join patient advocacy organization or support group to feel less alone, because it's a very